to be doing a NG tube insertion here. So the first thing that I'm going to do is I'm going to go and I'm going to verify the medical order. And at that point, once they're verified, I'm going to go gather up all of my appropriate equipment. For this procedure, it's going to be a pair of scissors, some tape, an emesis basin, some tissues, pH paper, a syringe, and the appropriate length tubing and width NG tube. So I'm going to go into the patient's room, closing the door behind me to give the patient and myself some privacy during this procedure. I'm then going to perform proper hand hygiene, and I'm going to don any PPE that I might need. I'm going to identify the patient using 2 markers, their name and their date of birth, and I'm going to verify this on their wristband. I'm then going to explain to the patient what it is we're about to do. I'll let them know we're about to insert an NG tube, let them know why we're doing it, and I'm also going to let them know of any discomforts that they might have and how I'm going to be able to alleviate those discomforts. So this time, I'm going to raise the bed to a comfortable working height, usually about elbow height. I'm going to sit the patient up into a high Fowler's position if they're able to be. If not, 45 degrees is appropriate. I'm also going to drape a towel over the patient's chest. And here we are going to assess which nostril is going to be best for the procedure. I'm going to ask them if they have a deviated septum, if they have any noticeable congestion in one side more than the other side, because we want to put in the clearest side possible so that way it's as easy on them as it can be. I'm then going to measure the length of the tubing from the nostril to the earlobe to the tip of the xiphoid process. And for this, it's going to be at the 40 mark. And I'm going to mark that with an indelible ink marker. I'm then going to place the tubing back down on the table next to me. I would then put on my clean gloves, and I would ask the patient if they desired any kind of topical anesthetic or any kind of spray for their throat to reduce any kind of irritation. I would then take the tubing, and I would lubricate 2 to 4 inches of the tube, and I would ask the patient to tilt their head backwards, pressing it against their pillow, and I would let them know that we're about to start the procedure, and I would be pointing the tube upwards on the floor of the nose, and I would let them know that once we got to the pharynx, that they might gag a little bit, and I would offer them tissues and the emesis basin. Now at this time, if I hear them gagging more than I expect, I'm going to take my pen light and a tongue blade, and I'm going to check inside their mouth to make sure I don't see any coiling of the tube. As long as everything looks good, we're good to proceed. However, if they start to gag a lot, or if they're coughing, or if they're gasping for air, or if they're turning blue, I'm going to stop the procedure immediately. Now, once we're here, I'm going to give them a cup of water, as long as they're not NPO. So when they take a sip of water and they swallow, I'm going to advance the tube. If they're NPO, I'm just going to have them take normal swallows without anything. Before we start progressing any farther, I'm going to have them take their chin and touch their chest. Progressing every time they swallow, stopping when they breathe, so that way I don't accidentally go down into their lungs. And we're just going to advance up here until we get to the marker that we marked earlier. I'm then going to take a little piece of tape, we're just going to loosely secure the nose, so that way it doesn't come out while we're finishing up the procedure. We're then going to take the syringe that we had, we're going to place it in here, and we're going to pull out some stomach contents, and we're going to take the little pH card that I brought with me, and I'm going to dab it on there and give it 30 seconds, and then we're going to read it. During that 30 seconds, we're going to be visualizing the contents so we can see the color and the consistency. After that 30 seconds is up and we've analyzed the pH of the stomach contents, we're going to check to see if a x-ray was ordered, and usually that's either physician's orders or a facility policy to confirm the placement. Now once the placement is confirmed, we're going to take off the syringe, cap it, place it down. We're going to then take off this, and we're going to apply a skin protectant. I'm then going to remove my gloves, and while that skin protectant is drying, we're going to prepare our tape, cutting off a 4-inch piece of tape, cutting halfway, about 2 inches, bottom of the tape. We're going to then apply the uncut portion to the bridge of the nose, and 2 cut pieces in X fashion on the tubing. I'm going to put gloves back on, and I'm going to ask the patient to turn their head opposite the side in which I've inserted the NG. I'm going to measure the length of the tubing that's left outside. I'm going to mark that with indelible ink. I'm then going to check the orders again and see if this needs to be attached to suction. If it doesn't, I'm going to cap it, and I'm going to attach it to their shoulder with a safety pin or a rubber band or whatever the facility has to do that. I'm then going to put the patient in a comfortable position. I'm also going to lower the bed back down, put the side rails up. Also, if they had a sump pump, or if they were going to be attached to a sump pump, I would just double check to make sure that I attached it above the stomach level. I would ask the patient if they had any immediate needs, and I would start to remove all of my PPE, any of my garbage that I had, perform proper hand hygiene, and then I would let the patient know that I would be back every 2 to 4 hours to perform proper oral hygiene, clean the nares, as well as offer any throat lozenges to reduce irritation, or any throat sprays, or anything for the nose. I would also lubricate the lips generously so that way there was no irritation.